Coronavirus. Transmission, symptoms, and treatment. The ongoing coronavirus pandemic derives its name from the Latin word corona, which means a crown or halo. This is because when the virus is viewed under an electron microscope, it looks like it is surrounded on all sides by a solar corona. Coronavirus is a large, approximately 125 nanometers diameter, positive stranded RNA virus that is enclosed by a protein envelope. Coronavirus gets its name from the S protein spikes on its surface, which look like a crown. The S protein binds to and penetrates the host surface by binding the angiotensin-converting enzyme 2, HACE2, receptor. Coronaviruses cause a range of illnesses, including COVID-19. They typically affect the respiratory tract, but their effects can extend well beyond the respiratory system. The virus, which has led to the death of over 3,029,087 people globally and counting, could be traced back to Wuhan and Hubei in China. Authorities at the World Health Organization, WHO, received a report on the 31st of December 2019 that a cluster of viral pneumonia cases of unknown cause had broken out in Hubei, China. At the start of the new year, January 2020, an investigation was launched to ascertain what was wrong. By the 30th of January 2020, there were 7,818 confirmed cases across 19 countries. Thus the WHO declared the outbreak a public health emergency of international concern. A newly discovered virus, SARS-CoV-2, causes coronavirus. This virus is closely linked to bat coronaviruses, pangolin coronaviruses, and SARS-CoV. Most of the early infected persons had visited Wuhan seafood whole market. Thus the virus is assumed to be of zoonotic origin. On the 13th of March 2020, the South China Morning Post published a report suggesting that a case traced back to the 17th of November 2019, a 55-year-old from Hubei, may have been the first person infected. Transmission of coronavirus. Coronaviruses frequently transfer their host from animals to humans. Zoonosis. From humans to animals, reverse zoonosis, between humans and between animals. With deadly SARS, MERS, and 2019 COVID, transmission occurs through close contact with infected individuals, especially when they have a runny nose, and are sneezing or coughing. Urine, respiratory droplets, saliva, or stools from infected persons produce contagious viral particles. Good hygiene practices are paramount to avoid contracting this virus, such as washing of hands and avoiding unprotected contact with animals. Hospitals are a significant location for the transmission of the virus, nosocomial infections, as infected persons are intubated due to respiratory distress. Delay in diagnosis provides enough time for the virus to spread to health staff, family members, and those within the confines of the healthcare unit. Individuals with lower respiratory tract disease are the key transmitters of infection, as the virus affects this area more frequently. Symptoms. The symptoms of human coronaviruses are very close to those of common colds or flu. In this new strain of coronavirus, symptoms begin about a week after the infection has risen and spread more rapidly. According to the governing health body, WHO, symptoms that show a person is infected by the virus include fever, cough, shortness of breath, breathing difficulty, aching muscles, loss of sense of taste, loss of sense of smell. When the virus has developed to a severe state, it leads to pneumonia, failure of body organs, and eventually death of the patient. This is the dreadful thing about the virus. Based on studies, the incubation period for the virus is between 1 to 14 days. When we say incubation period, it means the time the patient is infected till the time the symptoms of the virus begin to show. A good number of infected patients begin to exhibit symptoms within 5 to 6 days. Surprisingly, some infected patients do not display any of the symptoms. Research revealed that the death rate among coronavirus patients was more prevalent in smokers and people who had underlying health conditions like hypertension, diabetes, heart diseases, etc. Regrettably, the elderly are also more susceptible to the virus. Treatment for coronavirus. Currently, no known cure is available for COVID-19. Antibiotics aren't effective against viral infections such as from coronavirus. Researchers are testing a variety of treatments. The FDA has recommended the use of the antiviral medication remdesivir, Veklury, to to treat COVID-19 in hospitalized adults and children who are aged 12 and older. The FDA has consented to an emergency use authorization for the rheumatoid arthritis drug baricitinib, Olumiant, to treat COVID-19 in some cases. Baricitinib is a drug that seems to work against COVID-19 by curtailing inflammation and possessing antiviral activity. The FDA states that baricitinib may be used in combination with remdesivir in people who are hospitalized with COVID-19, who are on mechanical ventilators, or need supplemental oxygen. 3 monoclonal antibody drugs have obtained emergency use authorization from the FDA. Monoclonal antibodies are proteins produced in a lab that can help the immune system fight off viruses. Treatment consists of a single intravenous infusion given in an outpatient setting. To be most effective, these medications need to be given soon after COVID-19 symptoms start and prior to hospitalization. The U.S. National Institute of Health has approved the corticosteroid dexamethasone for those hospitalized with severe COVID-19 who are on supplemental oxygen or need mechanical ventilation. Other corticosteroids, such as prednisone, methylprednisolone or hydrocortisone, may be used if dexamethasone isn't available. The FDA has also approved the emergency use authorization for convalescent plasma therapy to treat COVID-19. Convalescent plasma is blood donated by people who've recovered from COVID-19. Many individuals with COVID-19 may have mild illnesses and can be treated with supportive care. Supportive care is aimed at relieving symptoms and may include pain relievers, ibuprofen or acetaminophen, cough syrup or medication, rest, plenty of fluid intake. Complications of coronavirus infection. The most severe complication of COVID-19 is the form of pneumonia known as novel coronavirus-infected pneumonia, NCIP. Researchers have also seen the following complications in people who developed COVID-19: acute respiratory distress syndrome, irregular heart rate, kidney injury or failure, severe muscle pain, extreme fatigue, heart attack, multi-system inflammatory syndrome in children. If you would like to be informed of health tips and information that we dedicate our time to create for your benefit, kindly subscribe to this channel and click on the notification bell. Until next time, thank you for watching.